A 22-year-old girl presents with a primary complaint of difficulty in swallowing, which is progressing over the last few months. And on examination and on further inquiry, she also stated that there is change in voice, and also there were history of multiple episodes of renal stones. There is a family history of thyroid cancer where her uncle underwent a thyroidectomy at a very young age. And on doing lab tests, it was shown that her serum calcitonin level was elevated. Ultrasound of the thyroid shows hypoechoic thyroid lesions. Which of the following should be considered before attempting surgery in this patient? Option A, MRI of the thyroid. Option B, 24-hour urinary catecholamine determination. Option C, urine 5 HIAA levels or the chest X ray.